We activated the Emergency Operations Center on March 16th, 2020, after it became apparent that the pandemic had the potential to spread throughout not only the United States, but certainly our community and the state of North Carolina. And the goal and the overall objective to activating the Emergency Operations Center is to have a centralized location where there can be coordination in response to the disaster that's anticipated or is actively occurring. And this was an area, or our EOC was a location where public health, emergency services, and so many other community partners initially came together to formulate response plans in anticipation of the pandemic becoming widespread.
So one of the main things for public health is any type of communicable disease. So we deal with that all the time. Clearly, we've never had a pandemic before. So when we first started talking about that and what that might look like, clearly testing was the biggest thing. We have to figure out who has it, who's positive, and make sure that we get them quarantined and at home. And so we've dealt with quarantine before, but this was on a way bigger scale. And so making sure what that looked like, household contacts, making sure they stayed home. And so working through all of that so that we could get people home and make sure that people got healthy. So testing people was a huge part of the very beginning to make sure we knew who was positive and get them home so we could get them healthy. We knew that that influx of questions was going to come in. So we just kind of started rerouting our staff to different areas. We started taking people away from what they normally were doing just to answer the phones and answer the questions about what people wanted to know about testing and did they need to get tested. And so I just pulled the entire staff back into just talking to the public, making sure the public felt comfortable with where we are and what they needed to do.
So early on, we started going out into the community to do some testing. Wanted to make it as accessible as we could. Obviously, demand began to be really high, so some of those initial test sites we learned a lot about traffic flow. It was obviously the weather was super hot and we were in gowns and N95s, and it was definitely a wild time there at the beginning when we started doing test sites. We were testing hundreds of people each day and learning as we went how to organize things, get results to people, and learning just how much demand it was going to take and how much teamwork it was going to take. So testing was important because I think early on in the pandemic, people were confused about what to do. Healthcare actually became less accessible, which is kind of the opposite thing that you would want in a pandemic. And it was important for people to be able to identify if they had COVID so that they could quarantine themselves, isolate from their family, and not spread the virus. And so that was our main goal, was to make it accessible, efficient, and free for the public.
So I think one of the biggest challenges was making sure that we had enough staff to take care of the community and figuring out who was going to do what in that area, but also making sure that we were still providing public health services to the community, because those services are still so critical. So that was a challenge to figure out how we were going to continue with our public health services, but service the community in a pandemic, and figuring out which staff was going to do that. And once we did that, and everybody knew their new role in pandemic world, we were able to just go with it and roll on and make sure that the community understood what was happening and what it meant to them.
When we first started testing, we were doing tests here individually. Our first off-site test was actually June 1st of last year, and it was over at Addie's Chapel. It was a new experience for all of us, so it was a lot of learning. The first several sites that we had, we learned a lot. We kind of grew from it, learned from our mistakes and went from there. We've kind of run the gamut with testing. We started out, a little bit slower in the very beginning, and then as the year went on, our testing sites, we went to 3 days a week. We were tested anywhere from 250 to 300. We even saw 350 tests, come through in a single day. That would be in a 2-hour period. So we were doing a lot of tests, and that's really crucial, when you get to your contact tracing, because the more tests that you see and the more positives, then you can kind of follow it through the community.
So when it first started out, I was doing the contact tracing. It wasn't as big yet, and it started from the very first one we had positive. We called the people to ask them, who's in your house, who's been tested, who's not, who's symptomatic, where have you been, who have you been in contact with, And a lot of people think we're trying to get into their business. And that's the father's thing. I don't have time to get into people's business, but I do have time to make sure that if everybody around you needs to be tested, they need to be tested, and we'll find a way to do that for them. The point of contact tracing is to make sure that I stop your progression from going forward, getting other people infected.
So throughout this pandemic, early on, we began seeing a lot of misinformation on social media in different locations, to where I asked the EOC team, make sure one of our main objectives is always stick to the facts, put out what we know, and ensure that the information that we do put out is correct and trustworthy. And I'm proud of what our team has done throughout this pandemic. We've always told the truth. We've always stuck to the facts. We never got into the political fray of this pandemic. And we have taken every action to protect the health and wellness of the citizens that we serve in this community. So when we look overall at some of the core objectives, health and wellness of our county citizens and our visitors, ensuring that we maintain critical services throughout the pandemic. And that was something that was really a challenge. And for many agencies, it has been a challenge and could potentially be a challenge as we move forward. If you have too many employees at one time out with the virus, that can compromise the services that are offered by public safety, by critical infrastructure, so forth. So numerous objectives that the EOC has had throughout that I'm really proud that I think our team has met all of those objectives since the beginning.
Initially, early on in the pandemic, access to testing was definitely a barrier. You had to have certain symptoms. You couldn't just be in exposure. Testing supplies were very limited. And so through work with the state and our logistics officer, the entire team at the EOC, we began to create that plan. The state supplies came in more frequently. And so then our tactic changed. We wanted to be able to ensure that anyone who wanted a test could have a test in a drive-through fashion. And so more and more people were able to be tested and isolated, because we started seeing, initially people thought COVID was the fever and all these severe symptoms. And we started learning that it's oftentimes more, people might think they just had a stuffy nose or allergies. And so making access to testing was really important so that people could have that knowledge and information about if they were positive or not, so that they could quarantine. So again, access to healthcare was key and continued to be difficult throughout the pandemic, continues to still be difficult. We know that historically marginalized populations are more impacted by this virus, those who are having to get up and go to work every day, who may not have the luxury of working from home, etc. And so we really wanted to do that outreach to make people feel safe, so that they knew that it was free, no ID, the less barriers, the better. We were able to partner with community leaders in the Latinx community and the African American community. Folks like Kathy Areola and Paula Swepson Avery were key in partnering with those. We were able to go out into these communities instead of making them come to us and make that more accessible. So for us, it was also important to make sure that people had the information in the way that was easiest for them. So we were able to translate information in flyers. So English and Spanish has always been available since the start. Our COVID hotline's available in English and Spanish as well. On site, there's always at least 2 or 3 of us who are bilingual, able to speak Spanish and English. So people are able to get the education and the information live as they need it in the language that they need. In the rare event that we have someone who speaks another language other than Spanish or English, we are able to partner with our 911 center where we have a translation line that we can connect with. So that's been very important as well.
So the pandemic or COVID-19 has been unlike any other disaster where the United States had not seen a pandemic of this proportion really since 1918. And this was a significant challenge to quickly formulate response plans. While most agencies, including ours, had a pandemic plan, it certainly wasn't going to meet the need of what we were facing. Lots of unknowns. And I think that was what really worried us early on, is we were essentially writing the protocols and the plans because no one had ever seen anything like this during our lifetime.
In the beginning, when it was just testing, we did our first few testing sites at the health department because we were just learning how that was going to work. But like I said, once we realized we needed to be in the community, the EOC, Emergency Services, has great mobile services. So we were able to get to all those communities that may not have been able to get to the health department, maybe weren't sure about coming out and getting tested. So we took our testing site to all the communities out there that we could think of that might want to be tested. And every day we were somewhere different all across the county. So we went from one corner of the county to the other to make sure that we tried to hit all of those communities. And once communities realized we were doing that, they started reaching out to us saying, hey, can you come to this church or can you come to this neighborhood? And we would be there and we would test whoever wanted to be tested.
So some of the initial priorities at the EOC was one, gain better situational awareness of what we are facing and what we could potentially face. Some of the projections were just downright frightening when we looked at the potential of loss of staff due to them contracting the virus at high proportions. We were concerned about, obviously, the health and safety of all the citizens in McDowell County. We were concerned about medical surge, of there being more patients than medical resources. And then overall, you worry about your family, your friends, the personal aspect that we all dealt with through the pandemic and continue to deal with to make sure our loved ones are safe. But there was so much planning that had to be done in really a very quick amount of time to ensure that we were ready for when this pandemic struck in McDowell County.
So as the surge became more real in McDowell County with cases of COVID-19 increasing, from an EMS perspective, it became more apparent that our paramedics were going to be at high risk of exposure. And we were seeing more and more patients with COVID transported every day. Not necessarily patients who were able to advise that they were positive, but patients who just had regular symptoms that might mimic other illnesses. And so it was really important to protect our paramedics because they're in the back of that ambulance in a very small area. And so we switched to totally wearing N95s early on. Surgical masks, we know, would only offer partial protection. We moved to wearing masks in the station so that the paramedics were protected in the living quarters so that they would not spread the virus to each other. We know in the news there's been lots of outbreaks in different stations, fire stations, police departments, etc., EMS even. And so we did not want that to happen for our folks. We're really fortunate that it has not happened for us. We've been very careful, and so that's been our response for that.
So one of the early things that the EOC planned for, working in conjunction with our healthcare partners in the community, was for the potential of medical surge, meaning that we had more patients calling EMS than we had ambulances available to take care of them. More patients showing up in clinics or at the hospital, and it overran the amount of healthcare resources that were available. Lots of hours went into planning, lots of long hours, overnight hours of folks coordinating with each other, sitting down and working out plans that were logical and that we could easily meet those objectives, tapping our state and federal partners to gain additional assistance. And in any type of EOC activation, you want to write worst case scenario plans and you want to be prepared for worst case scenarios. We have a motto that we live by at the EOC. It's over prepared and underutilized. And if you're over prepared, that minimizes the surprises that can occur during the disaster.
You know, so when we first had those few cases, it sends a little shockwave into the community. It's here. It's in our community. It's not around us. It's here. And so I think once we got through that, yes, we have positive cases in McDowell County, and then the numbers started rising. It's like it started all over again. So we were on the phone just continuously. Contact tracing is exhausting because you start with that positive and you back up to every contact they had. And the more contacts we found that were positive, the numbers continued to rise and continued to rise. And we knew that that transmission was high in the community. We have to figure out where that transmission is happening, first of all, get people home so that we can stop the transmission. and then move on with that. But I think it was overwhelming for the staff when those numbers started to really climb, and it was hard to keep up with not only the positives and the contacts, but so many people at that time were getting tested, so we had a lot of negatives. So our whole team, again, the EOC, the Operations Center, Emergency Services, all had to pull together to call the negatives and do the contact tracing, because it's a lot of phone calls and it's a lot of information that you have to get with any positive and all their contacts.
First outbreak in long-term care is probably one of the things that will stay with me throughout my career and really the rest of my life. It's definitely a memorable moment of this pandemic, and I think about the families, the patients, the staff in a number of these long-term care facilities and what they went through when we had our first outbreak in McDowell. I remember many phone calls in the middle of the night, 2, 3, 4 o'clock in the morning, with different individuals calling to discuss situations in these long-term care facilities. At times, many of these situations were extremely critical, folks needing assistance. And that's one part of this pandemic that'll stick with me for the rest of my life, and that I'll always remember, is what a lot of folks endured during that time. When you look at the number of citizens that we've lost during the pandemic, for us at the EOC, knowing who a lot of those citizens were, it's really moving, because these aren't statistics. They're individuals. They're brothers, they're sisters, they're mothers, fathers, aunts, uncles. They all had a wonderful life. And tragically, it was taken from them by COVID-19. And those families and friends and these patients are ones that I think about daily. And that was what I think drove a lot of us at the EOC and all of our community partners during this pandemic, and why we're fighting so hard right now to roll out vaccines in a fast, safe, and efficient manner, is we know the tragic consequences that COVID has taken on this community. As we're filming this video, 74 lives have been lost in McDowell County due to COVID, and that's 74 too many. And every day that we came to work at the EOC, and every night that we were working, we had one objective in mind, and that was to protect the lives of McDowell County citizens and do what we thought was best in the interest of our community to stop the transmission.
So the first vaccine site was on December 28th. We've done a small group of healthcare workers from the health department, EMS, and some other local entities. The strategy was to start small and then learn how to grow our drive-through clinics. We knew we wanted them to be drive-through because it's efficient and there's less risk of exposure. It makes it easier for the public. And so we started at the health department. We quickly learned that we weren't going to have the space to do the large quantities that we wanted to do, and that's when we partnered with the high school for a couple weeks until we could identify a larger location. And now we've landed at Grace Community Church, where we can do thousands a day if we were to receive the supply. Supply continues to be limited on vaccines, so we've seen that since the beginning. There has been improvement. Early on, we never really understood what we were going to be receiving each week. Made it extremely difficult for planning and understanding how many appointments we could book. But the state has fixed that in the last month, and so it's been very good to understand what we're going to get. Even though supplies remain limited, we can easily plan how we're going to roll this out and be equitable and efficient for the public.
I think there's no words really to describe how everybody felt when that happened. To get that first vaccine in that first arm, and then just keep rolling it out. And I think that first day we did, about 20 maybe, just a select group of people to kind of try it out, see how it would work. And now we're doing hundreds a day. Just to go from that, it's so exciting to be able to get that out to the community.
So I think the priority when it comes to vaccines or even testing is access for us. So that's been our biggest priority. We try to look at all the barriers from people who don't have internet, people who may not have phone access or transportation, and how can we mitigate those things. So we knew we couldn't just do online signups. Elderly population and a lot of people in McDowell don't have access to internet, so we knew we had to have a call center. We've partnered with transit to make sure that transportation is easily taken care of. Our community paramedics can go out into the public to people's homes if we can allow that, and give people vaccines. So really just identifying barriers, whether it's transportation, access, whether it's language barriers, and figuring out how to overcome those so that we can make this as accessible and equitable as possible. So one of the biggest challenges since vaccinations began is how consuming vaccines have been. With testing, we were able to still kind of maintain some sense of normalcy with our normal duties in EMS and all of our other departments, but this is a team effort. It takes a lot of people from a lot of different places. We've got EMS, public health, law enforcement comes out each day to help with traffic control, U.S. Forest Service. We've even got people from the library helping in the call center. And so it kind of does take away from those people in their normal everyday duties. And so trying to manage that and balance those things to make sure that, for me personally, that the EMS organization is running smoothly, but also that we're taking care of the public with vaccines is priority.
I think the biggest thing for me when I look back on the years, on this past year, is the relationships that have been formed and how critical they are. I think in McDowell County, the relationships are always good and they're always solid, but when everybody has to rely on each other so heavily, it's critical. Those relationships are critical, and a pandemic isn't the time to build those relationships. You've got to already have those in place, and we did have that here, and I think that's why it ran so smoothly. And every day you call somebody for help, or they call you for help, and it's so easy to do that. Hey, can you help me with this? I'll help you with that. So I think the past year has taught me how important relationships are. I think it's so important to have that community connection so that people trust leaders, they trust public health, they trust emergency services to take care of them and know when a pandemic hits, I've got great people that are going to take care of me. And I think when you know that about your community, it's so important and it's so critical.
We have the best team, the best people in this community. It's really shown how we work together, how we come together, and we can literally overcome anything that comes our way.
Our promise to the citizens of McDowell County is when this pandemic finally ends, that our team writes a comprehensive after-action review, and we leave it for the next team that may be faced with a pandemic. There was no playbook. There was really no protocol book that any agency across the United States. Everybody had pandemic plans, but COVID-19 quickly showed those plans weren't going to be sufficient for the monumental task that was forthcoming back in March of 2020. We've learned a lot through this disaster. Looking back, there was things that if we had to redo again, we would pivot and do it a different way. But that's our commitment to our community, is we constantly strive to move forward. We look at things that we need to improve upon, but we'll absolutely leave an after-action playbook for the next team. God forbid it may be faced with another pandemic. As the Emergency Services Director for McDowell County, I want to take this opportunity in closing to thank each and every citizen for your acts of kindness, words of encouragement, thank you letters, emails, but most importantly, your prayers for all of the individuals working this pandemic. Providers from all across this county, volunteers from every corner of this county, and agencies have all come together to protect you and your family. We appreciate your support, and it's been an absolute honor to be able to serve you during the COVID-19 pandemic. As we move forward with vaccinations, we encourage you to receive your vaccination. But we also remain committed to putting an end to this pandemic. Our testing continues, our vaccinations continue, and our daily public information messages to you continue. Thank you for your support. of the McDowell County COVID-19 operation.